We thought, I remember the first time we had a mass for survivors of suicide loss, we thought maybe 150 people might come to this mass or submit their names. We soon found we had like over 1,000 people.
Hey, everybody, and welcome to another edition of Talking Catholic. I'm John Mauro, and with me today is Mike Walsh.
And this podcast, without hyperbole, may be one of the most important podcasts we've ever recorded. You're going to hear this interview in a few minutes, but Jen and I just finished a Zoom call with Bishop John Dolan, the Bishop of the Diocese of Phoenix. There's an event coming up soon, of which he will be the keynote, and it's on a pretty heavy topic, but he addresses it in such a beautiful and pastoral way.
Yeah.
He's really at the very cutting edge of intersection of spirituality and mental health care.
And science.
And science, yeah. And it was really a fantastic conversation, one that we could have probably talked to him for another couple of hours. Truthfully.
It went by very quickly.
Yeah. But the nice thing is, we know he's coming to New Jersey soon.
Yes.
So the date, I think, is what, May 2nd?
Yeah. So Bishop Dolan will be the keynote speaker of the New Jersey Catholic Mental Health Conference on May 2nd. This will take place at St. John Newman Pastoral Center in Piscataway. Mm-hmm. And it is being kind of put together by the New Jersey Catholic Conference, the public policy arm for the Catholic bishops. They've been working on it for a very long time. There's going to be quite a few speakers. It'll start at 8:30 a.m. with Mass with Cardinal Tobin from the Archdiocese of Newark, which is great, and then we'll hear from Bishop Dolan as the main speaker. The conference is called "From Isolation to Belonging: Mental Health and the Catholic Church." Before we kind of get started, I just want to let people know that some of the topics that we'll be speaking about today, and Bishop Dolan himself, are of suicide, mental health challenges. So just want everybody to know if you're listening and those things might be upsetting to you and you're not ready to listen yet, put it on pause. But I really encourage everybody to listen because you're going to hear some really amazing stories from Bishop Dolan of his personal life, what he's gone through with members of his family. But what's beautiful and what Mike alluded to is that Bishop Dolan has founded an Office of Mental Health Ministry in the Diocese of Phoenix. It's actually the first of its kind in the United States. And I love this quote that he says. The Catholic Star Herald has done a couple of articles, I hope you've seen them, talking to every single one of the speakers. And we started with Bishop Dolan, which was great but one of his first quotes that he said, and this is something that's always been close in my heart, it's the reason I came to the Diocese of Camden, was Pope Francis's quote of "The church is called to be a field hospital." And that is the way that Bishop Dolan looks at it as well. And he really talks about what that means in mental health ministry is that we meet people where they are. And he says we tend to their wounds and we walk with them toward hope. And hope, as St. Paul tells us, does not disappoint. And, that just gives you a taste of what his absolute pastoral way of talking about mental health in the upcoming interview that we're going to have with him here. Yeah,
and don't be afraid to listen. We don't get it. We do talk about, serious topics, but we do it in a way you've come to, get used to on our podcast, but also is his nature as someone who talks about in very real ways, but very pastoral ways. So I do hope even if it's a difficult topic for you, you'll hang with us. And for those of you who have been hoping to hear more about this, particularly in our own parishes and dioceses, the state of New Jersey at large, the Northeast region, this conference that's coming up is a truly great opportunity. Piscataway is not that for those of us in the South here, not that far away. I go up there semi-regularly for meetings, and it's a lovely drive. It's a pretty easy drive. And I will say, to their credit, they have the nicest diocesan offices in all of New Jersey, to the point where their auditorium is absolutely a great place to be for a meeting like this. So it's a good place to go. You'll enjoy it. There's a Target about half the mile up the road if you need anything.
There's good food. I was just up there recently for a different event, and the food was excellent.
Yeah.
So
it's worth the effort, not just for the Target, but it's worth the effort for heading up there and being a part of this conference, particularly if this is something that's touched your family. If you know that there's a need in your own parish or in your own community, school community. He talks about the work that they've even done in the prison ministry system related to mental health. So it's a pretty wide area that if there's ever been an issue that you thought you might have a concern related to mental health and what the Catholic Church can do more of to better serve people in need in our communities, I think it's a good conference to go to. So I encourage people to go to it, and certainly you can definitely read up more about Bishop Dolan and what they do in the Diocese of Phoenix as well. There's great ideas in there. He's been quoted many times. He's written some great columns and articles for a number of the Catholic publications. So he's a great advocate.
So I just want to mention who this conference is good for. First off, seating is limited.
Well, wait, before we get any further,
what?
Should we tell people how they can learn more and register?
I was just about to say that.
Okay.
Because seating is limited. Okay. You want to go and sign up as quick as you can because registration is needed. So you go to www.njconf.com. So that's New Jersey or njconf.com. It stands for the New Jersey Catholic Conference. So please go sign up. This is for everybody. There's a lot of talk about in this conference and in the other speakers about the pastoral leadership. We're talking about lay ministers, priests, deacons, religious. But the point of the story, they're going to be talking about ways we accompany each other, and that encompasses all faiths. If you know a chaplain in a hospital, invite them. Those chaplains who serve in the military, those who work at Veterans Affairs offices, Stephen ministers. This is good for anybody like that.
Yeah.
And so it's really, really open.
And your pastor might not know about it, so bring it to his attention. You may have deacons who might be. We have a number of deacons in the Diocese of Camden who do great work, particularly related to mental health. On the off chance they haven't read about it in the Catholic Star Herald, feel free to bring it up to them.
Please.
But it's I mentioned this in the podcast later, but. Even I've received requests for, does the diocese plan on doing anything more with mental health? Do any of the ministries plan on doing more with mental health? And I'm happy to report we are. That actually is something that's we're all hoping to see in the very near future. We don't know where it may land, but those conversations have already begun, and I'm happy to report that. But it's needed, and it's needed because the people need it. This is one of those things that isn't necessarily a top-down kind of thing.
Not at all.
It's sort of a grassroots thing. We've had masses. There's been a number of Catholic Charities events that have been specifically for people who are going through mental health concerns and are looking for prayerful support. That these things sort of exist, but what Bishop Dolan has done has sort of codified it into the very nature of the diocese in Phoenix and in the parishes in Phoenix, where it's become institutionalized in the sense of it's now brick and mortar as much as it is a hope, a dream.
So one of the people who are attending the conference, and actually you'll hear us bring him up, Bishop Dolan brings him up, is Deacon Ed Schoner from the Diocese of Scranton. He actually he's the founder of an organization called the Association of Catholic Mental Health Ministers. And we interviewed him in the Catholic Star Herald. If you go to that website, it has basically a starter kit on how to start a mental health ministry. So if you're in a parish and you're interested, you can go to his website and look at how to do it. Exactly what you were saying, Mike. It is grassroots.
Yeah. So there's a lot of opportunities. It's certainly a bit new for any faith to be sort of diving into this. Not new. There've certainly been churches and ministries who have been dedicated to this over the years, but it's there's such a broader desire for it now.
And on this level.
Yeah.
So I think we'll go into the interview with Bishop, and then you'll hear the interview, and then we're going to come back and we're going to tell you a little bit more about the conference, who the other speakers are, and a little kind of regroup on the conversation itself.
You got it. So enjoy Bishop Dolan. He's a good guy.
So welcome, Bishop Dolan, to the podcast.
Well, it's great to be here. I'm really looking forward to this conversation.
We are very honored that you agreed, and also we're on a 3-hour difference. Is that correct?
I think so. I think it's about 3 hours. Yes,
okay.
Kind of like Gilligan's Island's 3-hour tour.
So Bishop will be a little more fresh because it's morning-ish there, and
That's right.
Mike and I are on our 6th cup of coffee over here in the afternoon. So, but thank you so much for being with us.
My pleasure.
So you've agreed to come on because we do have a wonderful event coming up here in New Jersey. Like we were speaking about a second ago, it's the Catholic Mental Health Conference. Bishop, can you say a little bit about, first off, how you got involved and why you wanted to get involved in this conference? You are the keynote.
Well, I happen to believe that a conference call together on mental health is really important. And it was actually before I was ordained a bishop in California, the California Catholic Conference gathered together and they put together a pastoral plan, or maybe it was just a pastoral letter on mental health in general. And I found that, wow. So I landed as bishop there just as it was being published. And that was the first ever conference that size that dealt with mental health on such a scale. And from there, it kind of helped to blossom, and our Office for Social Ministry in the Diocese of San Diego started to take note of that. The Diocese of Orange was starting to grow in some capacity, again, through their Office for Social Ministry and so on. But I do believe that if conferences are having these conversations and initiating efforts toward mental health ministry, I think it's a way to go. Conversations, help to as springboards for future growth and planning. So I think it's a way to go. So I'm very interested in helping the conference there in New Jersey. I think it's just going to be a blessing.
So
And
this
that's
conference
something
to a lot of different people. Sorry, Mike. So clergy, educators, parish leaders, parents, mental health professionals. Why such a big group of people? Like what
I think it because in my mind, mental health ministry is very similar in my mind to even OCIA, because it's kind of the cutting edge. You're meeting people where they are. And when you think of OCIA, the inquiry process, people are coming with a lot of questions. And you may not have all the answers at the time when they're asking those questions, but they feel valued because they're able to ask those questions. I think the same thing with mental health ministry is basically once we're opening the doors, we may not have all of the answers when people are struggling with their own mental health related issues, or maybe they're struggling with the loss of loved ones through suicide, or they're just struggling with like, how do I navigate mental health related issues in my family while also navigating family in general. So the more we, if we're able to open those doors, then we're accompanying people where they are. You just start with where they are. I think that's the cutting edge. And that you to your question about why so many people, because really it is kind of a whole person care concept. It's not just the priests. It's not just the the religious. It's not just the front desk people in the offices of parishes. It really is everyone. And the more we can get that information out to as many people as possible, the better we are going to be as a church on the front lines in that world of accompaniment.
Bishop, you mentioned earlier something about the importance of talking about these things and being open about them. In my lifetime, and I suspect in yours as well, we sort of saw that slow migration of nobody ever talking about the difficulties in their own lives or the difficulties in their families. I remember I've had mental health issues or situations in my family going back for generations. And I remember as a child, the hushed tones that maybe you would get a nibble here or a nibble there that somebody was going through something. To now, I know amongst the people who are my son's age, they seem a bit more open-minded to it, or open to discussing it rather. But for older folks in particular, I would say it's still an uphill climb. In what I've seen that you've written in the past, you are incredibly open about your own family's difficulties when it comes to mental health and the survivors of certain issues. I'll let you talk about those, and sort of how you've come together and sort of come to the forefront of this as a bishop now. And it's sort of a beautiful story. I've read all of your writings about it, and your openness is wonderful to see. Would you like to talk a little bit about your own connection to mental health?
Sure, and maybe and then I could wrap it with the initial portion of your question. Yes, but I had I'm a survivor of suicide loss and in different levels. The first was when I was 13 years old, so that's an interesting level because I was 70. It was like in the 70s. It was in like 77, I think, or so, 1977, and then. That was my brother Tom, who died at age 19, and then after entering the seminary, I was there in college seminary. In my junior year in college, we had lost a brother, and I'm sorry, my sister Therese and her husband both through suicide when we were gathering as a family for Thanksgiving, and we were waiting for them, and they did not arrive, and that kind of blew out the desire to be thankful. Let's just say that. Yeah. But all of that was during a time it was in the the early 80s, early 80s. And then my sister Mary had died by suicide shortly after I had arrived here in the Diocese of Phoenix, and after I had established the Office for Mental Health Ministry, or it was just right around that same time. And so she was around 55 years old, and I was much older. So it's just interesting as you look at the pathway. I shared with you that we did lose, I did lose someone else just most recently. I'm really not at liberty to kind of go into detail because my family has not yet released that, or a family member has not yet released that, and I want to respect that. But it was interesting in a conversation most recently after this most recent death in our family that someone shared, how have you progressed with this? How have you dealt with this over the course of these, many years? And one of the words that came out, not of my mouth, but of this person, was, "Are you numb to this?" And I guess it was a word that would probably satisfy, the concept of where I am. But in truth, I think a better word is that I've matured with this. And maybe going back to your question, or your initial part of this point, Michael, was that that when I was 13 years old, not only did I have the capacity to manage this and to talk about it, because I was moving into the teenage years, and you don't talk about a lot anyway in those years. Mm-hmm. So that's part of the issue. So as you well know, teenagers tend to clam up when talking about feelings and so on. But secondly, we didn't have the capacity even to have that conversation because of the mental health then is light years ahead, away from where we are today with with MRIs, fMRIs now, with the ability to track what's going on in the brain, with AI now. everything is it's just light years. So the conversations that we would have had then are completely different than what we are able to have today. Completely different. The 70s, as we know, I mean, to even talk about personal computers in those days was still relatively new. So it's just amazing. So just that general sense of, so I don't try to beat up the people of my generation, because we just didn't have the capacity to do that. But then, and because of that, I'd say, because everything was relatively new in the field of psychology, it was kind of it wasn't a trusted discipline then. And partly because we felt, you're on a couch. Maybe that was kind of the view. You have to be on a couch and you have to talk about your problems and your foibles in life. And nobody really wanted to talk about that. That talk about being, put in the world of stigma. That's really hard. Today, to your point, I think our young adults are able to talk about this freely, because we do have the capacity, and we're seeing the great signs of communication. When you look at the wounds that you might have, that it's not a mind over matter issue. It's truly a physical matter. That's why it's important for us to address the brain as not the brain as a piece of the body, just as we would talk about other physical aspects of our body. If I break my arm, or I have to wear glasses because of poor vision, all of those things we talk about just without any sense of stigma. This is what happens. But when we're able to speak about the brain itself as a physical matter, then people go, aha, that's not a problem. Then I can actually say, yeah, there's something that directly impacts the way I behave. And even though it can't be seen, we know through science that this explains a lot. It explains a lot of why I am where I am. Yesterday, I had a conversation with a high school here in Phoenix, and I had given 2 different sessions to roughly 600 students, and they were glued. And my basic opening question was, how many of you have a phobia? And they all most of them raised their hands. And then I just asked them, what are those phobias? And then I started with, most of our phobias begin with the amygdala. It's that fight or flight part of our brain. And I admitted that I have a phobia of dogs because I was taken down when I was a little kid. And so that amygdala piece still works, trying to work to navigate and communicate with the frontal lobe and all of those different things. And so they were understanding that. And I said, it's not just a mind over matter thing, although you can have coaching, so external coaching that can address those phobias. But that's a good way to begin a conversation to talk about those phobias. And I was just pleasantly surprised to have that number of hands raised when they admitted that they had phobias, and they said it freely. It was beautiful, actually. It was a wonderful thing for them to say and admit to. But it's a safe place to begin a conversation.
Yeah.
Bishop Dolan, just so you know, speaking of safe places, you have reached a safe podcast. This podcast loves talking about the confluence of science and faith. So that was actually going to be one of my questions to you, was because I read it in one of your articles, was you seem very open to it. You kind of went to length here, so I won't ask you to retrace it. But was it difficult for you to kind of come to grips, or not come to grips, but to find that integration of science and faith? Or was that something that sort of came up naturally as sort of, you were saying before, you become more seasoned in the discussion?
It really took off in a great way when Deacon Schoner, Ed Schoner, who's from Scranton, came out to the Diocese of San Diego, and we were then initiating a conversation with the University of San Diego to establish this mental health ministry. And the Catholic, what is it? Catholic mental health ministers. It's the collaboration of mental health ministers across the nation and now international mental health ministry. But at that time, we were definitely addressing the science of it. And thankfully, we had Dr. Wendell Callahan, who is at the University of San Diego, who was helping us move this rapidly. So we were creating a curriculum to focus on mental health ministry. And that we all agreed, first thing we have to do is touch on the science, which is what we do in the Diocese of Phoenix, is that we're focusing on education, advocacy, and accompaniment. But education, we felt, was the absolute first go-to, to speak with the priests, to speak with the religious, to speak with our deacons, and to get them trained up in what we call mental health first aid, which is, it's an 8-hour program. But I tell you what, those who go through it, the 8 hours go by quickly. Because it's a lot of aha moments for them, and it just helps them to go, that's why my friend or my family member ticks this way. And it's not a moral matter. It's really a clinical matter that we're addressing. So I found that science is really a great way for us to begin the conversation. And that's why, like with these young adults or these youth in the high school, when I ask them to raise their hand about their, their whatever their phobias are, they readily raised their hand and shared their stories. And I thought that was very good. And I just said, well, it's a part of the brain issue. It's an amygdala issue. It's not a bad thing. It's an amygdala issue. It's planted in our brain for a reason. Now, how do we navigate that and work that with the frontal lobe and the left and right lobes and all of that? That's a whole nother matter. But
Bishop, do you do a lot of research on your own? Sounds like you were very well versed in the science part as well.
Well, I don't have I'm not a clinician and I don't have a degree in it, but I do find myself interested in why certain pieces of the brain act, they go awry, what's going on there. And it's not that the pieces of the brain are going awry, it's that they're not connecting with the other pieces. So that, to me, they're working well, but they're not connecting well with the other pieces. So on their own, like the amygdala, the fight and flight piece, it's working well. It's just not able to connect efficiently with the other parts of the brain. Holes in the brain, that's when that is when you're talking about holes in the brain, physical holes in the brain, either because of concussions or matters like that, or just they find holes in the brain where the brain hasn't been, the head hasn't been bashed or anything, but PTSD actually initiates holes in the brain, or drug use can help initiate holes in the brain, which prevent blood flow and things like that. So those are some of the basic building blocks that I think I can speak, where I can speak freely. When it gets into true neurological related issues, I'm oblivious to that, and that's good. And so I'm a good speaker I'm a good advocate for going to those who know and stay away from those who don't. But even all that said, most psychologists most psychologists say that they have about 40% of what's going on in the brain. So that's pretty amazing. We really don't know a lot about the brain even today, but at least we know enough to say there's something amiss in the physical compartment of this body that we need. That we can focus on medicine, we can focus on psychiatric care, and then we also rely heavily on psychological care, clinical care, that external locus of control that every one of us need at some time of our life, so that those counselors are just a great benefit for us, because they're able to assist us when we just can't work on ourselves. Our internal locus of control is out of whack.
So I'm curious, Bishop, in your local area, this you were very much at the forefront of all of this. And I'm curious, what was the response like, both in San Diego and Phoenix when you sort of brought this out? I know I could tell you locally in South Jersey, I've only recently, only within the last year, maybe, have I heard from pastors and lay ministers of a desire for something like that here in South Jersey. Was it you mentioned earlier that it took some education, but did you find that you had a willing group of clergy and lay people who were looking forward to something like this?
Uh, it was interesting. I don't think they had a full grasp of the priests around me didn't really have a full grasp of what the need was. I don't think they really understood that. And to be honest, I didn't either when I first started this. I just felt like most priests or lay people, we need to pray more, and that's a good place. I mean, that's a good thought. But the more I dealt with this, the more I saw we really do need to study this more, because that's going to open up the bigger picture. But once we did open up some avenues, open up doors, in San Diego, we opened that door with the Office for Social Ministry. And then when I came here and opened up an office for mental health ministry, to focus on education, advocacy, and accompaniment, it just all of a sudden people were coming through the doors. They were pouring out the walls. It was just incredible. I just had a mass. The first thing I did was have a mass. I did one in San Diego, or two, I guess, in San Diego, for survivors of suicide loss, and it was just quite emotional. The number of people who were coming in, and what I liked about it's not ideological, because everyone is affected by. Can be affected in some way or another by suicide loss. So that I found was very helpful. And we've made sure that it doesn't stay within that ideological framework, because it isn't. Mental health affects everybody. And then, but then coming here and opening up that door, we thought, I remember the first time we had a mass for survivors of suicide loss. We thought maybe 150 people might come to this mass or submit their names. We soon found we had like over 1,000 people submit their names. So then we had to just draw the names across the screen during the entire mass. So it was just impressive. Wow. And then the number of people coming up the aisle with their carnations, it was just incredible. So, you open up those doors, open up those avenues for people to talk about their mental health related issues, or for people to talk about how they might navigate their home when someone else in their home is struggling with mental health. And you're also just trying to, make the rest of the home secure, safe, and all of that. So it's just really amazing. Yeah. But people, and also in addition to that, by opening up those doors, it's amazing how many people will throw some money at that to make sure that it succeeds. It just comes. I haven't really had to solicit anything. It just comes. So our Office for Mental Health Ministry is sustained primarily because people just say, we want to help.
Can we talk about your Office of Mental Health Ministry?
Sure.
Exactly what does it offer? Especially when, in addition to the Mass, right before we were talking about that, it kind of dovetails in. You said something when you can't work for yourself, when you can't work on yourself. You get to a point where you realize, I can't do this. And it's hard to take that first step to ask for help or even seek it out. So how does your office come into play with that, and what does it offer?
Well, the first thing, what it doesn't offer, we always say very clearly for legal reasons, and we go through this on virtually every podcast. We talk about our little mental health minutes that we used to at least throw out there. We always say we don't diagnose, prescribe, or treat. We don't do that. That's not mental health ministry. Mental health ministry, for the most part, is about loving people, encountering people where they are. That's the first and most important piece. That's why I said it's like cutting edge, with OCIA, it's the cutting edge of the church, is meeting people where they are. It's accompaniment. It's synodality. It's listening to them, which is where we're going as a church. And I think that's just absolutely essential. But then, as I said earlier, we focus on education, accompaniment, and advocacy. Those are the three pillars of the office. So the educational component, especially through mental health first aid training, is important. Then also kind of weaving into the accompaniment portion is training people how to facilitate these accompaniment sessions. And what are those accompaniment sessions? We basically try to find venues within the diocese where people can come for any host of things. It could be behavioral health related issues like AA. It could be survivors of suicide loss sessions. It could be people who are just struggling with their own mental health, and they're able to converse and feel welcomed within the diocese and within parish life. We've learned very quickly that it's not about just gathering people and tell us about your mental health related issues, because it doesn't really. First of all, it varies, and then secondly, it's a little heavy on the navel gazing. But really, we focus more on. We just take scripture for the coming Sunday. That's probably where it becomes very effective, and then maybe allowing them to say, how does this affect you? How does this relate to you personally? And how does that make you a better Christian or a better person? Some of our accompaniment sessions are interreligious, so that's another piece of the puzzle. It's not necessarily getting people to have a conversation about conversion or any of that. It's really more about letting them know that they have a place in humanity and also in the life of the church. And then the other is the advocacy aspect. And we've been very successful connecting with, like, the sheriff's department here in Maricopa County, trying to get peer-to-peer groups within the prison system, because often those who are inmates are they might have mental health related issues, but they don't really have the opportunity to see a counselor, but maybe once every couple of months. And especially if they're having psychiatric related issues, it can be really troublesome, not only for them, but for the rest of the inmates and staff. So we can offer, through this point of advocacy, we were successful in establishing these kind of wells, these places where people could come and have peer-to-peer gatherings. And we've trained inmates on how to conduct those sessions. So it's really a way to just gather people within those circles and have them share. And it gives them an opportunity to kind of get out of their cell where they're able to do that. So that's a good thing. The other is we're very successful in an adversarial way. Is that right? The word, as advocates, not adversarial, but to be advocates for our Maricopa County health program. We were able to create 350 more beds for mental health patients in one of our county hospitals. So those are just a couple of examples of what we've been doing in the world of advocacy. And because we have money pouring in, we have directors for each of those pillars. One for advocacy, one for accompaniment, and one for education. And we have a director who oversees it all. So it's a lot of money, but the money hasn't been a problem because people are throwing it at us. It's truly amazing.
That's great to hear, because it's such a it's great to hear because it's so needed and there's such a desire to be a part of it. And it's something that I really hope to see really comes across as a wave across the country, that we'll see more dioceses being very open to this kind of ministry from the diocesan level down to the parish level. So and I love the fact that you're ministering to the incarcerated as well. That's it's a wonderful element to that.
Well, it's a part of. We also have an office for prison ministry and restorative justice, and a lot of that begins in the prison. So,
Yeah. That being said, since we're on this topic, what would success in Catholic mental health ministry across the United States look like to you?
that's a hard one to weigh. Honestly, it really is a hard one to weigh. So we are trying to create a dashboard of making sure that we have those, at least in the Diocese of Phoenix, we're trying to, we want to see how many parishes have these advocacy venues. We call them wells, as in the woman at the well. Jesus meets the woman at the well, and from well comes wellness. She leaves her bucket behind. She's able to go and feel joy and proclaim that she feels well, and so that's a big piece of that's one of the things that we could probably analyze pretty quickly. How many parishes are doing offering these wells or these venues for accompaniment? Secondly, we can assess how they are effective. What are the needs? What are people actually drawing? Why are they drawing close to these wells? Why are they? What are the actual programs being offered? Is it for survivors of suicide loss? Is it specifically geared to say a behavioral health related issue, maybe a kind of concept, or is it for people who are struggling with mental health? And are they subdividing some of those sessions for people who may have, say, schizophrenic or paraschizophrenic disorders? So those are the things that we're going to work on. Or we've only been at this for 3 years, but I think we're at the point where we need to analyze this a little more carefully. So analytics are important. It's going to help us move ahead. I don't know if that answered your question, but that's on the local level. I think on the national level, where Deacon Ed Schoner and his who is really pushing the International Catholic Mental Health Ministry Association. He's looking at those analytics as well.
And his group is the Association of Catholic Mental Health Ministers, correct?
Correct.
And I think the two of you have even collaborated, or you were an editor.
We helped. We were again with the University of San Diego. We were establishing a curriculum on how to establish mental health ministry, and then we found it necessary to establish this association of Catholic mental health ministers. Again, more importantly, just for us to talk about best practices, right. What's working, what's not working.
Wonderful.
Well, Bishop, thank you very much for joining us for the podcast. To our listeners, we have to release him back to his diocese. He's actually going off to say Mass shortly. But thank you very much for being with us, and we can't wait to see you on May 2nd up in
yeah, that's Jersey. I'm really looking forward to that. So give my best to all there in New Jersey.
All right, we will see you soon.
Blessings.
I got to tell you, Jen, that was for talking about such a heavy topic. Mm-hmm. That was a genuinely delightful conversation about stuff that affects us all. I mean, you and I have talked about it. We've probably even mentioned it on this podcast that we come from families who have had to deal with mental health issues. Yep. This is not new for me. I think I mentioned it briefly. I remember as a very young person being told about how my grandfather had what did they call it back in the day? She was going to bother me. I can't remember the phrase because it's you don't hear this phrase anymore. And he had a breakdown, and he had a very difficult job, and he just sort of, just wasn't able to do anything for a while because, he kind of had hit a wall, and thank God it didn't go further than that, and he did recover from it. And he was a person of note in his industry. And the fact that he, sort of recovered from it and was able to come back into it, but it was never spoken about. Like you didn't talk about it. But I do feel like we're in a time now where people are becoming a bit more open about that, and people are willing to say things. Have you ever thought about going to therapy? Like back in the day, that might have been considered an insult, and now you could say that and go, hey, I haven't considered that. So I do think we're moving forward.
I mean, I liked Bishop Dolan's story, even the fact where he was talking to the high school kids, and the kids were the students were very forthcoming about what some of their phobias were, and then Bishop shared one of his. But I mean, and when I was in high school, back in the olden days, that wouldn't have happened. Yeah. I mean, and how you shared, with kids your son's age, they're not afraid to talk about it.
Yeah,
We've come such a long way, which is so wonderful.
Yeah, I remember the phrase that my grandfather suffered from was nervous breakdown. You never hear that anymore. You never hear anything like a nervous breakdown anymore.
That's a good point. You really don't hear that
term.
I
think that's because we've defined the terms better. He mentioned that in the podcast as well, which is, the science behind these things has gotten so much better to understand. I mean, you mentioned that, we only really know 40% of the brain, but that's...
Which is also fascinating, by the way.
Yeah, true. But we're probably, like, that back then it might have been 35%, or 5%,
I was going to say less,
the other way around.
Yeah.
But it's the fact that it's so much better now, I think says volumes about where we've come as a culture. But the truth is there's so much further to go.
So much.
But as evidenced by the family difficulties he's had. I mean, 3 suicides far ago. Hold on. There are several suicides in the past, and now 2 in recent memory for him. And it's like, as I'm sitting here saying how far we've come, you can see how far we still have to go.
Yeah.
So, we should say that there will be other people present for this conference. You want to say who else is joining us?
Yep. So I'll mention again real quick that Cardinal Joseph Tobin is the celebrant for Mass that morning and the homilist. And then the other speakers, in addition to Bishop Dolan, Deacon Ed Schoner from the Diocese of Scranton, again, founder of the Association of Catholic Mental Health Ministers. He and Bishop Dolan have worked together for years now on mental health. They even have a book together, in addition with the Association of Catholic Mental Health Ministers, called Responding to Suicide, a pastoral handbook for Catholic leaders. And then we also have, as a speaker, Ben Wortham. He is the Vice President for Behavioral Health Integration at Catholic Charities USA. And then we also have Beth Halbsby. Yep, I wrote it down. I listened to a podcast on how they pronounced her name so I could get it right.
Oh, nice.
Yep. Halsby. And she is the program director at Notre Dame Fiat Program of Faith and Mental Health, the Notre Dame University in Indiana. Yeah. So it's and then there's, did I get the state right?
Maybe. I don't know.
Okay. And then,
unlike some people, I don't have a great affiliation with Notre Dame, so sure, whatever.
Okay. And then also so all of them will be speaking during the day-long conference, 8:30, should end around 3:15, 3:30, and there'll be time for a Q&A at the end as well. There's lunch, so register.
Yeah, it really is a good opportunity. I know it sounds like we're really pushing this, but it's just that, Jen and I sort of come at this from different angles. But the truth of the matter is, I'm willing to bet most listeners, most people are people who have dealt with mental health in some way. And there are a lot of people out there that are still struggling with it, and some who refuse to do anything, and some who are doing everything and still kind of spinning their wheels. But it's something that has to happen. It's something that we have to help wherever we can. We, certainly here we talk about Catholic Charities, and we also talk about Vitality Mental Health Care Services and the work they do in the communities. Sometimes that work is very physical. people need food, people need shelter. But then sometimes it's psychological, and people need someone to talk to. And oftentimes the psychological aspect can be difficult. And, everyone sort of reacts to things differently. So there is no silver bullet. So it's good to be armed, for lack of a better word, with a number of tools for working with people.
Oh yeah. I mean, even Bishop used the words on the front lines, right?
Yeah.
Like the mental health ministry is on the front lines, and it has a lot to do with accompanying others. You mentioned a second ago, how some don't get help, and it's not, and he was, very, I think, straightforward in this. It's not for lack of wanting, like it's not mind over matter at all. What do you do when you can't work on yourself? It's not as easy to say, oh, well, just go pray, right? Like, it's not a moral matter, he says, right? It's a mental matter.
Yeah.
You do want the help. It's just, where do you start?
Yeah.
And a lot of times, where do you start? Where do you go? And the second part can also be, I just can't, right? Like, you're worn out, you're done. Like, you can't even get yourself out of bed, much less call somebody to help. So that's why it's so important, I think, to do things like this conference, so that you can accompany others, but also so you can maybe even help better yourself when you know that you're in that place.
Absolutely.
Then where can I go? Because I know that I'm not strong enough to do it myself. Who can I go to?
Yeah.
And we didn't talk to Bishop about this, but I'll be very curious to learn at the conference, because he used the word many, many times, listening, right? Mm-hmm. Listening, accompanying. And I think it's very easy for us when somebody, myself included, when I'm in a place and I'm just like, I don't necessarily want advice. I just need somebody to listen. And Bishop said that a lot about the listening and the accompanying. People need somebody to listen. And especially in today's time when everything is so loud and, everything's 24 hours. Is anybody listening? And I'll be really curious to see how much that is spoken about at the conference. From Bishop's interview, what kind of stood out for you, Mike?
For me, we kind of talked about this a few times, but he's so present, casual. It's going to sound strange, but he uses common words. He's capable of talking about the science of a lot of this, even though he doesn't give himself a lot of credit for that, as you heard in the podcast. But the truth is, I think he comes at this from a very, person-to-person level. I think he wants to make it as approachable as possible in terms of the ministry, and he talks about this. He talked about it in the podcast. They're not providing healthcare. That's not what they're doing. They're not providing therapy. They're providing the tools to get you to where you need to go, and they're providing the accompaniment and the prayer and everything else, and they're making sure that they're present in all of these communities, so that you have the opportunity. Because some people, even in this day and age, they don't want to talk to their parent or their child or their sister or their brother or their friend, but maybe they'll talk to somebody boss at the church. Unfortunately, they all talk to their boss. My people all talk to their boss. I need different kind of mental therapy, but it's just kind of a wonderful thing, and I'm so happy this conference is taking part. And we're very excited to be promoting it as much as we can, in the hopes that people will go and learn something more. So, thank you very much for listening to this episode. We'll be back next week with another great conversation that we actually recorded previously that we can't wait to talk to you about that. But should be fun, and we hope to see you in Piscataway soon.
On May 2nd.
See you, everybody.